Good morning, everybody. Bear with me as we try out some new technology today. So we will have to pass this microphone around, or the people on the internet won't be able to hear anything we're saying. And we're kind of assuming they can hear what we're saying anyway. So keep your fingers crossed for that. Appreciate everybody coming out this morning. It's kind of the same benefit enrollment meetings we've done in the past. Do have a few changes to share with you. Most of them aren't huge. There are some bigger changes. We'll jump right into it. Like last year and the year before, if you have questions, jump in. Don't feel like you have to save them till the end. I do want to point out that on Friday, from 1 o'clock to 3 o'clock, all of our vendors for our benefits will be at City Hall in City Council chambers doing open tables. So if you have individual questions for them, you can go in there and chat with them about that. So unless anybody has an initial question, we'll jump into it. So here's kind of our agenda. We'll talk about the medical plan. We do have a new medical carrier this year. It's going to be Humana. We're switching from Anthem. Talk about the opt-out program, the dental plan, vision plan, life insurance, and then we'll go through and talk about some of the AFLAC policies a little bit and the enrollment process. We will have a new wellness plan that we'll touch on a little bit too. I know this year we used Christ Hospital's wellness portal. A lot of people liked it. I can tell that because of the enrollment. We had well more than 100 people get involved in it this year, which was up about 40, 45 people from last year, which is almost a third more of our group got involved. So that was fantastic. The reason we're looking at this is Humana offers a really fantastic wellness product that can help us actually lower our premiums. They have a premium rate reduction program, so if you get involved, you will be helping the city keep our premiums down. We can show you how that program works one-on-one if somebody wants to come to my office and see what that all looks like. So here's what our medical plan is going to look like compared to last year. A lot of the same things. $3,000, $6,000 still the deductible. Your out-of-pocket maximum stay the same at $5,000 and $10,000. After you hit your deductibles, some of these copays do go away, so in that sense the plan is a little bit richer than last year's plan. There are some changes on the prescription drug side, though. So
that's not good.
One of the things we're doing here is we're running a disruption report based off of all the claims that went through Anthem last year to see who this is going to impact. So we'll be able to reach out to you individually to let you know if you're going to have an impact. But this goes to a four-tier prescription drug plan. You can see the rates down there at the bottom. That fourth tier are a lot of specialty drugs, things like the Hep C cure. There's a whole bunch of them in there. I don't know what all of those are. If you have questions on that, going to those open table hours is definitely a fantastic idea on that one.
So what is the Humana after you reach your deductible?
Covered at 100%, except for pharmacy.
Okay. Awesome.
So it's a similar but different plan. Anybody have any other questions on this? All right. Our expenses for this year on the employee side are going to stay the same as last year. One of the biggest reasons we made this switch from Anthem to Humana is Anthem came in, their best and final offer to us was a 9.5% premium increase. Humana came in and offered us about a 0.6 negative. So on the whole, things went down a little bit. What you don't see reflected here is that reduction depended on what your level of enrollment was. So if you were enrolled in a family plan, your premiums would have actually gone up a little bit If you're enrolled on a single, they would go down a little bit, and it kind of changed depending on what your enrollment level was. So on administration side, we decided the best thing to do was to keep them flat in terms of an equity thing. City has $2.47 million budgeted for health insurance this year. So that is up quite a bit from the last few years. Some of that is an increase in the wellness participation. But one of the things I want to really point out here is the rates that we're going to pay next year are lower than the rates we paid in 2015. And there are very, very few groups that can come out here and say that. I'm going to turn this over to Shannon here for just a bit from Humana to give you a little bit about the plan.
Got it.
This button will switch the slides.
All right. Gosh, let's hope I don't mess this up. Two things I have to hold. That's multitasking. Okay, so good morning, everybody. My name is Shannon Haru, and I am an agency relationship manager with Humana. So I've been working with the city and with McGowan Brabender on helping you guys look at your health plan for the next year. So, as you guys know, you're moving to Humana. You kind of saw some of the highlights, what the differences are. There is a packet of information on the table that you can grab on your way out the door. It goes through the medical plan and all the other things we're going to talk about today, as well as a really good brochure that's got all the information about the wellness program, which is called Go 365. So once you get on your medical plan with Humana after the first of the year, you're going to be able to go to humana.com and register on your website. And from there, you're going to have access to your ID card, your certificate of coverage, all your claims information, your pharmacy information. You'll be able to locate a provider, and you'll be able to check all the status around your deductibles, like how much have you met, how much is left, so you know exactly where your claims stand for the year. And there's some really good pharmacy tools that you'll be able to use since there might be some concern around the pharmacy. We also have some really cool apps, and I would highly recommend if you are a smartphone user, Apple, or you have Samsung, to download the apps. There's a My Humana app, there's a Go 365 app that you absolutely will want to download, and there's a pharmacy app. All of them are super easy to use. They're all free, but they will, once you log into the Humana website, you'll use that same username and login on the apps, and you should be able to get the majority of this, just about the same information. The website will have a little bit more, but you should be able to use the app. The cool thing about the app is your ID card is on there as well. So you'll be able to see the front of your ID card, the back of the ID card, so if you ever don't have it with you and you have the app, it will be on your phone. You'll also be able to, on the pharmacy app, refill your prescription. If you're using Humana Pharmacy, you can also move your prescriptions if you want from, if you go to Kroger or Walgreens and you want to use Humana Pharmacy. Humana Pharmacy, actually located in Westchester, and we have an office in Springdale. They actually are hometown, so you'd be getting your prescriptions from a hometown pharmacy. And there's also a pretty decent savings. Personally, I take a medication that if I were to get it filled at Kroger, it'd be like $560 a month. Humana Pharmacy is $0. So I get it mailed to my house, 3-month supply. So I definitely recommend looking into using the mail order program with Humana. Some other things that you get with your Humana plan, these are really just really cool benefits that you have access to. The first one is a nurse advice line. This is really neat because you can call this number 24 hours a day, 7 days a week, and speak to a registered nurse. You might want to use this if it's the middle of the night, you have a sick kid, and should I go to the ER? Is it really that bad? You can call this number and they can give you some guidance over the phone. I've used it before because my husband had surgery and I wanted to find out if I could give him another medication with ones that he was already taking, and I called this nurse advice line and they were able to give me that information. You also have Humana Beginnings. This is a great program for expectant mothers. We help and support them through the entire pregnancy and the first few weeks after with information. We send out a nice booklet. If they're high risk, we're able to help them connect with other people at Humana that can work with their doctor. So Humana Beginnings is a really nice program. And then a personal nurse. So personal nurses are registered nurses as well that would actually work with you to help manage a chronic condition. One might be maybe diabetes, to help you with diabetic medication adherence, to be able to help you with understanding your options, answer questions, and they'll contact you. It's not required, but if you do get a call from a Humana nurse, yes, and that applies to you, you can take the call. You don't have to opt into the program, but it is something that we do offer. Okay, the pharmacy tools. So if you go to our website, you'll be able to look up your prescription drugs. And when you're looking at your prescription drugs, you'll be able to see, it'll have your drug listed, and once you type it in, and all the different alternative drugs that you could take and what tier those would fall in, so you'd understand what your copay cost is. And then you'll also be able to compare the cost by pharmacies. And then to maximize your savings on prescription drugs is really using the mail order program or looking for pharmacies where you're going to get a better discount. I kind of touched on this already, the mail order program. It's really easy to use. You can do it over the phone with Humana. You can have the Humana pharmacy contact your pharmacy. You can do it on the app. You can do it on our website. It's really easy to move your medications over to the Humana pharmacy, and we'll have information about that in your packets.
Can I ask you a question?
You sure can.
Maintenance drugs,
Mhm.
there's going to be a fee for those? Because right now, for maintenance drugs,
So it depends on what it is. We have a long list of drugs that are a $0 copay, and I will bring those with me. And I think I've actually sent those to Diane. You should have those, the preventive list. If not, I'll send it to you. And then she can send that out, and those can be posted or sent to you guys. But there are a lot of drugs on there that are a $0 copay. This is called the preventive list, and it's probably similar to, not identical, but similar to what you may have had with Anthem on the $0 copay. Yep, but I make sure that you guys get a copy of that. Any other questions? I know pharmacy will probably be the one, there'll be a lot of questions. And we'll be there Friday if you're going to stop by and you have questions and you want to come to the table. Yes?
Can you look up any drugs, say your wife's on some drug, you want to look it up and see which pharmacy she uses? Or does that have to be your own specific drugs?
You can look up any medication on our website. It doesn't have to be for you. Obviously, you won't be able to see her medications, what she's taking or her claims, but you can look up any drug on our website. You can look them up now without even being a member. You can go look up our pharmacy stuff. We can send you a full list of those drugs so you know what tier they're in, and you can do some homework in advance. And then you can know, do I need to talk to my doctor about either switching to an alternative, or am I willing to move to mail order, or is it just that I like this medication, it works, and I'm going to pay the copay. So the difference, we ran a disruption report, so it really wasn't that bad compared to what people are taking from where they were with Anthem to where they are with Humana. Diane has that list, Noah has that list, so he'll be able to understand who's impacted by what medications. For the most part, and actually there were some positive changes. Some things for Anthem were in a higher tier, but they're a lower tier with Humana. So there could be positive changes as well. Not everything is going to be higher. So I wouldn't want you to think that either. But you'll have that list, Noah, then you can talk about medications individually with people. Okay. Any other questions? Have any of you ever used a doctor on demand, like a telemedicine, where you call a doctor on your phone? Yeah? Was it a good experience? Pretty easy. So this is also included in with your plan. It's a $49 copay. You have the ability to speak to a doctor 24 hours a day, 7 days a week. I've used it. My friend had to remind me that I had it. Went to the little clinic. It was a 3-hour wait. I said, no way. I went home. I'm miserable, laying in bed, and my friend said, why don't you just use Doctor on Demand? I'm like, oh, I totally forgot about that. Within 7 minutes, I was on the phone, off the phone, prescription called in, and my husband went and got it. It was easy. I had strep throat, didn't do a strep test, but it was strep. But I highly recommend that using this option. It's easy to do. You can do it with your kids. You can do it when you're traveling. I've had a great experience with it. Something that you can do is your doctor can also get the records and information from your telemedicine visit if they want. And now going forward, if you have to have lab work done, if the doctor on the phone says, I might want you to go get some lab work, they can refer you to either LabCorp or Quest only, those two national labs, if you have to have lab work done. So that'll be starting, you'll have access to that after the first of the year. And I think that's all for me for right now, unless you guys have any questions. Nope. Okay.
Thank you. All right, this one is more of an announcement here. For about the past year and a half, we have offered a concierge service called Compass. You might remember I sent an email out to a lot of people asking what their thoughts are, if they had used it. Most of the emails I got back were, no, I've never used that. And the bulk of the rest of them were, I used it and I didn't like it. Because of that, it has a very low utilization rate. We are going to be discontinuing this one. turn it over to Taylor to talk about the opt-out program a little bit.
All right, hey guys, good to be here. I'm Taylor Blackwelder. Should be pretty familiar now. This is the 5th year that the city's had their opt-out program, so things are basically staying the same. You'll learn a little more as we go on that there's some changes to the way the city's doing their wellness program, which I think is going to be really cool. One thing that the opt-out's going to incorporate is for people that are on, if there's some way that you're kind of losing an ability to earn money through the wellness because your spouse or dependent is waiving coverage, we're going to find a way to help incorporate that into the opt-out to help make that up. So, similar to how we've done it in the past with the HSA funding. Everything else is going to be remaining the same. So if you've had options that have worked well in the past, it's likely that we can still find a good way to make this happen this next year. I'd also like to mention, too, if you are finding that you're having trouble with a prescription or something like that, just with my own experience with, I think I probably mentioned to everybody at one point or another with my cystic fibrosis, I've had to get good at problem solving and figuring out different ways to get my own medicines filled. It's tricky every year. I'm on a high deductible plan, and my medicines are probably $100,000 a year. That's the full price. So I'm super thankful to have insurance. I recognize that it can be a challenge, and there sometimes are some good little programs from pharmacy, from drug manufacturers and other things out there that can help with some of the costs. So if you're finding that you're upside down on something, let me know. I'll be happy just to work with you. It doesn't mean you have to make a plan change. Maybe there's just something out there that can make this plan even work better. So keep that in mind. If you are participating in the opt-out now, we need to at least touch base for a few minutes. We want to get updated costs on your spouse's plan or whatever else you're doing. And if you're interested in, or anything going on, I'm happy to catch up and talk. So I will be available after this meeting, tomorrow's Friday, and then just anytime you need me over the next few weeks, you'll see me a bunch around. So let me know if anyone has any questions. Otherwise, I'll hopefully get to catch up with a lot of you soon.
Okay, we have some other changes on nicotine testing, and nobody is happier about this than I am. We are going to stop doing the blanket nicotine test right out the bat. What we're going to do this year, maybe on a trial basis, but I feel good about the way we'll do this. As you go through your open enrollment, there will be an affidavit in the Infinity system where you will say whether or not you are a nicotine user. If you say that you are not a nicotine user, then what we're going to do is we're going to add that on as a drug when we call people for random drug screens. So if you're in that group, you may be called for a drug screen for that throughout the year. That'll save us all from having to do that spit test that is disgusting, and you have to sit there and listen to me have an awkward one-sided conversation with you. Do want to remind everybody as you look at that affidavit that honesty is part of our 10 standards. So if you say that you're not a nicotine user and you're found to be a nicotine user, you may need to pay back premiums and you could face some kind of discipline for that. So please be honest. Dental plan. We didn't ask anybody from Dental Care Plus to come in today because the only thing to tell you about is that there's a 6% rate increase. So when you're talking about plans that are $12 for a single, it's not huge dollars, but it is going up a little bit. Other than that, you can see for a family, it goes from $36.17 to $38.80, $38.34. So it is a little bit of an increase, but the benefit levels all remain the same. If your dentist is already covered, your dentist will still be covered. We've done the same thing here with the vision plan. We're sticking with Emeritus again. Also received a small rate increase here, about 5.5%. Nothing changes with the plan design, so if you like the vision benefit, you can continue to keep using it just the way it's been done. Have both networks, the VSP and the iMed network, still available. Based on all of the plans that I have seen, this one is really great for a group like us because you can take which kind you like and you can pick the one that suits you. Again, no plan changes, so everything remains the same. Here's cost. All this cost information is going to be loaded in Infinity. I'll be sending some instructions for that out with the announcement that open enrollment is officially open. Anybody have any questions on vision or dental benefits? All right, you guys are quiet. Life insurance. No changes on the life insurance. We're going to stick with the standard as our carrier, so that means for folks in police and fire, you still have that line of duty benefit. That's an additional $50,000 should something happen to you in the line of duty. For the rest of us, the city is continuing to provide life insurance for everybody up to your annual salary, rounded up to the next $1,000. You can buy voluntary life insurance. Everyone is required to submit evidence of insurability in order to get that voluntary life insurance. That form will be available for you on Infinity, but if you sign up for it, make sure you send that in or you won't have the coverage.
What if we already have coverage, it's not just going to roll over?
It will roll over. This is for people signing up for new coverage or increasing the amount of life insurance they have.
I don't remember doing the insurability evidence of that. Did we have to do that?
You may or may not have had to do that in the past. Last year, it depended on how much money you wanted to have on yourself or a spouse or something like that, as to whether or not you had to do that. The other lines of coverage, employee, you can increments of $10,000 up to $500,000. For your spouse, you can do half of whatever you have on yourself, and $10,000 for each child. They are continuing to offer the voluntary long-term disability product. Coverage 60% of your eligible earnings up to a maximum benefit of $5,000 a month. Does have a 90-day waiting period, so if you're interested in something like this, you may also be interested in short-term disability, but do think about your sick leave balances when you're considering something like that. Benefit lasts until age 65. Also have to have evidence of insurability for that one for the standard. Any other questions on any of the standard products? There are no changes from the previous year. All right. Well, we'll have Amy, Aflac rep, come up. She's filling in for Bob today.
Filling in for Bob. If you can't remember Amy, I'll answer Bob.
Thank you.
Change the slides.
All right, awesome. Let's see if I can figure all this out. So I'm Amy, I'm with Aflac, and we're not making any changes to what we offer, what we have offered to you guys in the past. I just kind of want to make sure that everybody understands what supplemental insurance does and what it is. So basically, it's completely voluntary, and the difference between the supplemental insurance and your major medical is your major medical is going to pay like your doctors and your hospitals. The supplemental insurance pays you directly. So if you have a claim with your Aflac, you're going to get a claim check mailed directly to you, so you can help protect your cash flow, make other payments, do what you need to do to kind of keep things moving and concentrate on getting better. We have a short-term disability policy that we offer to everyone. It's a guaranteed issue short-term disability. That means that there's no medical questions, which is really nice, so you don't have to do the evidence of insurability. Yay. You can receive, you'll receive cash benefits if you are disabled due to injury or illness. The other important thing is that if something would happen and you retire or you have to leave your job here, you can take it with you. It's portable and it will remain at the same rate. So you get about a 40% discount getting it in a group as opposed to doing it individually. We are also offering group accident insurance. I call that the bump it, bruise it, break it, tear it plan. It covers just about any kind of accident you can think of, as long as you're not hang gliding, parasailing, doing something illegal or under the influence. Other than that, you're covered. So just, keep that in mind. It's very affordable rates. There will be packets up here and a sign-up sheet if you guys have questions. And of course, Bob will be here tomorrow and Friday. So, oh wait, I'm going to go back. I couldn't remember how many slides we had. Critical illness is the other thing that we offer. And we have these in each of the packets. And I just want to go over, this is really important. You can get, it's a lump sum value, and it goes anywhere from $5,000 to $50,000 is the benefit, depending on what you choose. And it covers cancer, it covers heart attack, stroke, major organ transplants, end-stage renal failure, and then a couple of other smaller things. But you know, as we age, these are things that we all worry about. So it's really affordable coverage if something like that happens. So, like I said, everything is in the packet. Bob will be here the rest of the week. That's all I've got. We can take it out.
All right. I feel like I'm kind of repeating myself here. Also, no changes for the enrollment process. We'll be using Infinity HR like we did last year. One of the things we kind of touted with Infinity when we went to it is that as you go into it in years 2, 3, and so on, your enrollment from the previous year will be automatically populated. So that will be the case. You won't have to call Sharon and say, Sharon, what did I enroll in? It'll be on there for you. So should make open enrollment a little bit easier for you. If you're somebody who wants to keep all the same lines of coverage, please resist the urge to just click next as fast as you can. Do take a second and look at it and make sure that it really has in there what you want. We'll be starting it on the 20th, so that's Monday. It'll roll through to the 29th. That's the following Wednesday. I know that will be a couple of days that are holidays, so I won't necessarily be available, but if you do send me an email, I'll be keeping an eye on that to make sure I can help people if they're getting locked out or if they need it reset. So just let me know. We'll have an email come out, like I said earlier. I will send updated instructions to everybody on how to use it. Did anybody have any big problems going through Infinity last year? Well, if you do, give me a call. I'll be happy to sit down and go through it with you. All right. The wellness program, auto funding will again be paid out in January and July. Wellness program, it's going to probably be paid out on 3 separate time periods. We're going to look at that a little bit because the wellness program is making some pretty major changes. We are, like I said, moving away from the Christ Hospital portal and going into the wellness program through Humana. Payout amounts are going to be the same. Your enrollment for the program may change a little bit. So your potential earnings on the wellness side are going to be either what you are enrolled in. So if you're enrolled in a multiple, you'll be earning at the multiple rate. If you're enrolled at a single, you'll be earning at the single rate. And to accommodate that, we've done some changes, like Taylor said, with the opt-out program to keep everybody whole on that. So I will turn it back over to Shannon to talk with you guys a little bit about Go 365.
Okay, thanks. Okay, so just to kind of help me understand, how many of you use the Christ Hospital Wellness Program? So everybody, pretty much. So I think you guys are really going to like Go 365. As a Humana associate, we've had this program in place for many, many years. Really love it. It's a great program. It's super easy to use. And the cool thing about it is you earn money. Yes, additional money that will be paid to you through our mall. And we're going to talk about that. Okay, so what it is, it's a wellness program that's based on certain levels of activity, whether it's engaging in education, prevention, fitness, lifestyle. You start out in blue status, and as you start to do activities within the program, you move through different tiers. It's kind of like the Olympics, right? You start out at blue, everybody starts out there together January 1st, and then as you do different things in the program, you earn points, and as you earn points, you move throughout the tiers. So there are three ways to get out of blue. Take our health assessment, which we'll talk about here in a minute. Have a verified workout, maybe using a Fitbit or a Garmin or your Apple phone, S Health or Apple Health, or do a biometric screening. Once you do one of those things, you will move from blue to bronze. Don't panic. We've got a whole bunch of people that are going to help you and educate you guys, and you're going to see so many Humana people out here helping. You're going to get this program to be really easy. So as you can see, though, when you're moving through these different tiers, if you have adults 18 or over on your plan, you will have to earn more points to get to the next level of engagement in the program. If you're a single person on the plan, you'll probably hit silver status by doing a biometric screening, taking your health assessment, and maybe connecting a fitness device and maybe doing some other educational things. It won't take you long to get the 5,000 points to hit silver. We think that people who hit silver are engaged in wellness because by that time, you understand how you're living your life, whether it's through your level of activity, your nutrition, your wellness, and you've taken a biometric screening so you know your numbers, you know your BMI, you know your blood pressure, your cholesterol. So we feel that people who get to silver are engaged because they're really aware of what's happening within their own lifestyle. To get to platinum, for one adult on the plan, it's 10,000 points. So just to give you an example how long it might take to get to platinum, some people may be faster than others, like Natalie was probably quicker than me. Humana renewed on July 1st. Everybody reset to blue. I just hit platinum now. I had 10,000 points. I'm the only person on my plan, so it took me several months to get there. But the year before, I hit platinum within 2 months. So it can be done, and you just have to look at all the different ways to earn points in the program. So the health assessment. You can do this in two ways. You can do it on our website. When you log in, you'll see a link to the far right called Go365. When you click that link and you say, where do I go for the health assessment? There's going to be a nice big banner at the top and says, click here to take your health assessment. Or you can do it on your phone, which some people like to do it that way because you can do it in small sections. Each section might take 2 minutes, and if you're between meetings or you're waiting in line at the grocery store, you can finish a section of the health assessment. So you'll go through your medical history, and then you don't have to worry about entering in your weight and blood pressure because you guys will have a biometric screening event, and when you have that done, that information will feed into our system, so we'll get that information. Talk about your eating habits, your fruits, your veggies. Do you eat them, don't you eat them? Talk about your tobacco and alcohol use, lifestyle habits. That's like wearing a seatbelt, texting and driving, things like that. Fitness and exercise, and then your mental well-being. And after you answer all the questions, you'll get to the very end, and you're going to get your Go365 age. Now, don't panic, because I can tell you that most of you probably will have a higher Go365 age than your actual chronological age. First time I took my health assessment, it said I was 7 years older than I really am. So I wasn't all that happy about that. The good news is they're even now. Those numbers are even, which is really cool, because I took a lot of steps to get healthier to make that happen. So you can take your health assessment, and your spouse can take a health assessment. It's not available to dependent children under the age of 18. So yeah, I talked about that age. So you see that little circle over there, your age is 45, and your Go365 age is 45, and your actual age is 39. That happens to a lot of people, but in a way, it's kind of good because it says there's some things I can do to improve that number. These are the different categories that you'll take in your health assessment: live well, the reduce stress, and there'll be little tiles on our website. You can click on them, or you can do it on your phone. It's really easy to get through the health assessment. Once you go through your health assessment, depending on how you answered your questions, we may set some goals for you, and they're going to be personalized goals. And not everybody's going to have the same goals because you're all going to answer the questions totally different. So we may find out that you're somebody that really has no ambition to eat your fruits and veggies. We might set a goal for you to improve your nutrition. Or maybe if you're somebody that has a desk job and you really don't get a lot of steps every day, we might set a goal for you to get more steps every day. The cool thing is when we set that goal and you complete it and you verify with us that you've done it, you're going to get a lot more points, which that's really one of the good things about the working with it. So when you get some personal goals set, you also have an opportunity to work with a health coach from Humana. There's no charge for that, and you can work with that coach if you want. You don't have to. Via phone, via email, via text. You can choose the method that you want to work with our health coach. Some people use it because they provide a lot of good information. Back care might be really important for the firefighters. You know, how am I taking care of my back? I'm lifting, I'm bending, I'm lugging a lot of heavy stuff around. That back care program might be really helpful. People who are working out in the field, dealing with a lot of maintenance, the same kind of thing. So there's just some really great information that the health coaches will share with you on how to make sure you're paying attention to good back care. I know people are laughing out there. Someone was laughing over here. So your biometric screening, why this is super important. How many of you really know your numbers? Did you guys get a biometric screening through the Christ Hospital? Were you surprised by what you saw? Did you kind of have a good idea? My first biometric screening, train wreck. I was a train wreck. My blood pressure was through the roof and my cholesterol was horrible. It was an eye-opener for me. My dad died of a massive heart attack at the age of 37. So I always say that Go365 probably saved my life because my age was different, right? My chronological age compared to my Go365 age. My blood pressure was 165 over 120, and I had high cholesterol. So those are all in range now. My blood pressure's great, cholesterol's great. I don't even take medication for cholesterol. But it's really important to know those numbers because some of these things are silent killers, right? I mean, high blood pressure, you usually can't tell if you have it. So you'll get your BMI, total cholesterol, blood pressure, and blood glucose. And from there, you're going to get a report on your health report back from whoever the vendor is that's going to do your biometric screening. If you have something that's out of range, we're going to give you a goal to get it in range. And when you get it in range, you're going to get points for it. So I've been talking about these points, right? How many points do I get? So if you get your biometric screening, it's 2,000 points. If you have all in-range results, it's another 2,000. Who remembers how many points a single person needs to get to silver from that first screen? 5,000. You only have to get 1,000 more points to get to silver status. So take your health assessment. You'll get a bonus for taking it the first time. So you're going to get another 400 or 500 points for the health assessment. You're about 500 points away from silver. It is really easy to get to silver status. And this is just the tip of the iceberg. So another way that you can earn a lot of points in Go365 is connecting a fitness device, going to a partner gym. It's not even just about partner gyms for going to like work out. We also have Spa Finder, so if anybody likes Pilates or yoga, but it's some place that's not like a national chain, you're able to get points for going to those places as well, which is a really big deal because in Cincinnati we have a lot of smaller gyms and smaller places where people want to go. There's a place called Core Strong over in Covington, and they're not connected, but now that we have Spa Finder, I can get points when I go there. So when you go look on our website, you're going to be able to type in the name of a location. You're going to see all the different locations that are partner gyms or fitness centers with Humana. We have over 40,000, I think now we're probably 50,000 nationally that we've partnered with. Planet Fitness, YMCA, there's so many, but you can find it on our website who is a partner gym. So you get points that way. Another way to get points is to connect a fitness device. So no, you don't have to run out and buy a Garmin or a Fitbit. You can, and those are Connect, and a lot of people find those to be very easy to use. That's what I use as a Fitbit. But if you have an Apple phone or a Samsung phone, you can even use your phone. If you connect Apple Health with Go365, you can get points just for carrying your phone around your pocket for walking. So you don't have to go out and actually, buy a fitness device. But we'll have a long list of all the devices that can connect, and when we come out here after the first of the year, we'll help you connect devices, help answer questions, and show you where everything's located on the website and on the app. When you go into the website, it's very easy to use, and then the screen doesn't kind of show that, but everything is listed in tile, so you'll like literally a tile square. Anybody use Pinterest? It kind of looks like a Pinterest field. Just scroll down the page and you'll be able to click on the tile. Once you click on a little tile, let's say it's activities. Well, I'm in a golf league and I want to get points. It'll tell you what you need to do to submit your golf league schedule to get points. Your kids can get points for sports and playing in different leagues. You can get points for running 5Ks, walking 5Ks, half marathons, marathons. All the different tiles or links on our website will show you what to do and what you need to submit to get your points for that activity. So this is just a screenshot of the points you will earn by going through all the different ways in earning points in the program. This one's around education and fitness, so it'll tell you what you can do and how many points you'll earn, and if it's every day you can earn it, once a year or once for the program. And the other side, education and fitness. And then there's prevention and healthy living. The packets that are at the table up here in the back of it, after you get to all the benefit stuff in the front, will be a Go365 booklet. That booklet will outline every single way that you can earn points. And when you're looking at the booklet, it's going to show you a phone or a computer, and it'll tell you if you can see it on your phone or if you can only see it on the computer. Most of it is the same, but there's some things that you can only see on your phone and some things that you can see on your computer. So you'll be able to look at that in the book and see where you can find them. Mm-hmm. That's correct, you're not, but if you do, one, and if you choose to do one even on your own, you can submit, or if you get, for your drug testing, you have one done and you're nicotine-free, you can take a picture of that on your mobile phone, on your phone, and upload it, and we'll give you points for it. Everything can be done on the website. Just go to Humana.com. You do not have to have a phone to use this program. It's not a smartphone. No, you can use the website. You just go to Humana.com and log in. Yep, so other things that you can get points for, so you guys have vision and you have dental. When you get your vision exam and dental exam, it's not going to automatically load on Humana's website since you don't have Humana Dental and Vision, but you can take a picture of your explanation of benefits on your phone, or you can scan it in and attach it in an email on Humana's website, and you can get points. It's 200 points for your dental exam and 200 points for vision. So you can get 200 each time for dental, and so 400 a year for dental and 200 for vision. So this is another way, just the other points in those categories. So a wellness program also should have fun things. So every month we have a jackpot where people are randomly selected to win a prize. Somebody on our team just won this week, or actually last week. She happened to be at platinum status, so she won a TV. So when you're drawn for the jackpot, you'll see, when you log into our website, you'll see it at the top, congratulations, you won. You're supposed to get an email as well. If you don't log in at least once a month, you may not see that banner because it only stays up there for that month where you won. But the higher your status is in Go365, the better the jackpot prize. So if you're at bronze status, you might get a Fitbit, sorry, not a Fitbit, just a regular pedometer to track steps. But if you get up to platinum, bikes, canoes, TVs, so the idea is we want you to get to platinum status, and then the better the better the gift is with your higher status level. Go365 app. The app is super easy to use. I highly recommend it if you have a smartphone. If you don't, like I said, most of the stuff is also on the website. Using the app is pretty cool because you can also join challenges or create a new activity. Let's say you want to park farther away from the office. You can set a goal for yourself to do that and then just take a picture and submit it and you get points. So it's pretty easy to use the app. I do like it. Something else that you'll have access to, which I don't know if we have it on here. We don't. Something else you have access to is healthy foods. So Humana's partnered with Walmart. So you'll have, I don't know, do we do that? We did, yeah. Healthy foods. So if you shop at Walmart and you enroll, you sign up for it and you get the card in the mail from Humana, you can get up to 50% off of your healthy food purchases. And you'll see those, they'll say the little good for you symbol if you shop at Walmart. So the way to get to 50% is playing a game on the app or on the computer where you actually have to kind of turn over little tiles and show healthy food versus bad food. And you can get up to 50% off. So it's a pretty cool savings through healthy food. So after all your hard work and you're doing all these great things to take care of yourself, you can go shopping in the Go365 mall. Each adult subscriber, so employee, spouse, can earn up to $300 a year in gift cards. So these gift cards can be at Target, Macy's, Lowe's, Amazon. You can use the points to actually buy apparel or fitness devices. You can actually donate your money to a charity if you would like to do so. So when you go to the mall, you can do it on your phone or you can do it on the website. You can spend the points to earn for everything that you've earned. I'm going to get ready to cash in soon, $300, and I'm probably just going to go to Amazon and use it for Christmas shopping. You can let those points and bucks roll over up to 3 years. At the end of 3 years, you have to use them or you will lose them. So if you're a saver, you want to let that money roll over and roll over. At the end of 3 years, you could have up to $900. That'd be for you and then for your spouse. So it's a nice savings. I mean, it's a nice benefit on top of the other savings you're going to get through your wellness program. So I highly recommend paying attention to that and trying to get to that silver status so you can get those bucks. Okay, so I know it's a lot of information on the program. We will have plenty of people to help, and then on Friday, if anybody's going to stop in, we're going to have, we'll have our computers there, and if you guys want to see what it looks like, or you want to look at any pharmacy information, we'll be able to access that for you then too. Does anybody have any questions? Yes.
Is it Go365 or Humana Go365?
It's Go365. I don't know, is it Humana Go 365? It could be. It could be. I downloaded it a long time ago, so it could be. Natalie will check. Yeah, you can, there'll be a Humana app, Humana Pharmacy, Go 365, and we don't have just one app because we do sell Go 365 as a standalone product, so it's a separate app. So any questions about the wellness program? Yes? Yes.
You mentioned that if all of your biometrics are in range, that was worth 2,000 points. Is that an all or nothing?
Nope. Great question. So you get a portion. So you get 2,000 points just for taking the biometric, and then up to another 2,000 for all those different ones to be in range. So maybe all of them are in range but one, so you may have a goal set to earn, to get those numbers in range, and then when you do, you get the points at that time. So you could get 1,600 points for in-range results instead of the full 2,000. But if everything's in range, it's up to 2,000. So a total of 4,000 for all of it combined. Yeah. There's a ton of other stuff in the program. It's not just the stuff I covered today, but I know we don't have time to go through all of it. So take the packets. If you have questions and you're going to stop by Friday, let us know. We'll be there. And then I think you guys are really going to like it. I think it'll be a lot of fun. Yeah.
Both, I know the fire department has their own gym here. We have a gym back at our peak. How do we get points for using our own gyms versus having to go out and join a gym?
We could do a beacon, right? Yeah, so, yeah, we can look into that. So there's something that we have called a beacon device, and you just stick it on the wall, and it's Bluetooth. There's a charge to purchase the beacon, but what it does, it automatically connects with Humana, and then when you're using that gym and you have your app, you do have to have the phone and have an app on your phone. You turn on your notifications, it'll recognize that you walk there and you'll get your points. So when we go through the details of points and fitness points and gym points, there's a max you can get every day, but we could definitely look into doing a beacon at both locations, if that's something that you guys want to do.
So, I mean, I know
Yeah.
we've got a lot of guys who use our gyms. I'm sure firemen as well, versus going out and joining
Sure.
a gym.
Right, what makes sense, yeah, absolutely, yeah.
Because we're from the community center, so we have our fitness center there. Could we get a beacon there?
We might even try to be able to get you guys just connected with Humana. We can look into that as well. Just have you be a partner gym that you would automatically show up in our center, like in our system. So we can look into that.
Because we have a walking track there too.
Yeah, absolutely. We'll take that back. Yeah. Yeah, that's something that should be fairly easy for us to do. So the other good thing about that is anybody else that uses your community center, if they happen to have Humana, it would then be a partner gym for them to use as well. Okay. Yep. Okay, thank you.
Two other real quick things on the wellness. We will have some meetings in January as we kind of gear up for all of this to dig into it a little bit more and help explain it to folks. The other thing is we are going to be doing the city's payouts to the HSA based on hitting the silver status and the gold status. Those are the two medals that when we hit, we get premium reductions for on our next renewal. So that's what we're going to be incentivizing folks to get to. Now, if you get to platinum, Humana will give you some more money, but we're out after gold. So, do you guys, Sue?
Do you know when you're going to do the biometric screenings this year?
We're looking to do them same time we did them last year, so probably in March.
March?
Yeah.
Well, the physicals we just had count for next year. I mean, we just had Chief? A week ago, 2 weeks ago?
That is a good question.
What was the question?
We have had our firefighters do a physical in November of every year, and we have allowed them to roll that over into next year. Is that something they would be able to do?
I mean, the date, they weren't, it has to be at the time we were a member.
Right, it would have to be after the effective date, yeah.
Okay.
So after January,
So
unfortunately.
we'll still have the biometric screening available for you guys.
The physical itself wouldn't really earn points. Things that would earn points might be like a flu shot or, mammograms, certain types of preventive screenings, but an actual annual physical itself doesn't earn points. So there's really, it wouldn't really matter if it was in November each year.
Okay.
Where would you get a nicotine test?
Where would you get a nicotine test?
I've ever had would be through the city.
You can buy them at a drugstore. You could probably go to like an urgent care and have one done there. But a place like a CVS or a Walgreens is probably going to be your easiest bet.
And that, there's a cost with that, so you guys didn't charge us anything to have a nicotine test.
Well, I think I got a couple sitting in my office if you really want to come do one.
I'll take a spit test.
Anybody have anything else? If you come up with questions later on, feel free to email me or give me a call. Other than that, appreciate everybody coming out this morning. Thank you.